Hi. So I'm going in to have my mandibular tori removed in about an hour, and I have been thinking about doing this probably for 40 years. I'm a dental hygienist. I'm retired. I've watched this surgery. I know what it entails, and I'm not looking forward to it at all. It's kind of barbaric, but I'm at the point where my tori are about to touch, and if they start growing into each other, it hurts and it becomes a problem. So I'm 56, and I've been in dentistry. I've known about these pretty much all of my adult life, and they slowly just have gotten bigger. So I want to show you. The sliding is terrible. This is hard. Okay, so this is my tori. Lovely, huh? They are about 2 millimeters from touching in the front, and they're getting pretty close to the attached gingiva, which is the part of the gum that attaches to the bone. So they're going to anesthetize me. I'm going to be getting conscious sedation, but they're going to anesthetize me, and then they're going to take a scalpel and incise the tissue, peel it back off the bone, and probably just tuck it down the floor of my mouth. Then they're going to take a drill and they're going to make little indentations in all that bone, and then they'll take a mallet and a chisel and they will knock them off. And then they'll go back in with a larger, like, finishing burr. I think it's an acrylic burr, and they smooth down all the bone. They'll feel in there to make sure there's no bone spurs, and then they will kind of tuck that tissue, all that tissue that's left because it's been stretched out, they'll tuck it back up there and suture it through. They'll actually suture through all of this, and they're dissolvable. So I have watched other videos about this, and very few have follow-up videos. So I'm going to make sure that I do some follow-ups. I'm expecting it to be pretty painful for the first 4 or 5 days. I have, I can't switch this over, but I have some antibiotics that I'm going to be taking. I also have some hydrocodone. Hopefully I don't need very much of that. I don't like taking it. I also have my mush and my push, which basically is just to make sure you don't get constipated and aren't able to go to the bathroom. Miralax to soften, which is a softener, brings water into the stool, and then laxative to push it out. So your mush and your push. And I'm also taking this stuff called arnica, and I've been taking it for the last week, and they just come in little pill form. You can put it under your tongue, or you can just chew them, and it's supposed to help with soft tissue repair. So anyway, oh, and then I'm also going to be rinsing with chlorhexidine, and I'll be doing this a couple times a day. It's a good rinse. It's antibacterial. The only problem is if you use it for too long, it starts to stain your teeth brown, like you drink a lot of coffee. So, but that can all be polished off. So anyway, here I go. Here, before. And I'll show you after. Wish me luck.